So now for the last part of the event today, we're going to wrap it up with a panel discussion that will be moderated by Rebecca Disler, Global Health Programs Lead at ID 2020. And then the participants will be G. Shaw, Vice President, Platform and Marketplace at Change Healthcare. And then Jeremy Springall, Vice President, Seat to At Borders. And Mr. Terry Jones, the founder of Travelocity and founding chairman of Kayak. All right, please take it from here, Rebecca.
Thanks so much, Jordan. And thank you everyone for joining us today. I also want to thank Eric for those remarks, particularly on implementation and lessons learned and what this looks like in practice, because that's exactly where we want to focus the panel today. Before we dive in, though, we also did want to provide a quick kind of context and level setting around the conversation today. So we know that the restrictions on mobility that we've been talking about have been necessary and appropriate to prevent the spread of COVID-19 and protect public health, and that the economic consequences of that, though, especially on travel and tourism, has been particularly staggering. And so what we're talking about are, as COVID-19 tests become more accurate and less expensive, and as countries begin the rollout of COVID-19 vaccines, all of this is increasingly exploring whether proof of COVID-19 status, so whether it is vaccination or a negative test, or in the case of the EU, proof of recovery, could be used to help safely restore travel and reopen economies. And the digital health credentials or passes that we're talking about, right, could make it faster and easier for airlines and border control officers to verify an individual's COVID-19 status while reducing the potential for fraudulent results and preventing misuse of data. So as we're talking about these pass systems, there's some level setting that we wanted to do right at the beginning of this particular panel conversation. So the first is that the World Health Organization currently, today, does not actually recommend COVID-19 vaccination or testing as a precondition for international travel. They acknowledge that this could change, particularly with better access to vaccines and testing, but there are still scientific unknowns, and Eric touched upon this, booster shots, but also protection against variants. Second, something we also want to acknowledge is that the vaccine rollout has been slow and inequitable, certainly within communities, but also across countries, and that ensuring access to the vaccination has to be a priority if we are to end the pandemic. And finally, something we just want to recognize, and Eric touched upon this, it's true, is that the concept of a digital health pass is a sensitive topic. There are very real ethical considerations that must be addressed around who and when and for what purpose an organization in general can request proof of COVID-19 status from an individual. So within that level setting, today's discussion is really going to be purposely focused on the use of these solutions in international travel. And it's also purposely practical, even with that evolving guidance, as we've seen and as we know, airlines and countries or institutions are rolling out these digital passes. And we know that they need to be dynamic enough, as Eric pointed to respond to that shifting guidance. So today we really want to focus on what can industries represented here do to ensure that these solutions are secure and protect sensitive data. Where are we seeing sort of real world, rubber hitting the road in challenges in verification and authentication? And how do we ensure interoperability across solutions that both enables that seamless customer experience, as close to the old normal as we can get, but also preserving choice and inclusiveness? So topics that require understanding of public health interventions, international travel ecosystems, technical architectures, and kind of relentless empathy for end users and customers alike. So very lucky to have this panel with us here today. Thank you, Jordan, for introducing. And perhaps Jeremy, we will start it off with you. I think it's really important to ground this conversation. Let's understand that experience of using a digital pass for COVID-19 status. So Jeremy, if you could walk us through how a traveler might obtain and use that pass, where and how that gets authenticated on that travel journey. And I would specifically request that in doing so, if you could share some of those pain points that you're seeing both for travelers, but also for airlines and border controls.
Yeah, great. Thank you, Rebecca. And I guess firstly, for those of you that aren't familiar with CETA, just to position who I am, CETA is a global IT solutions and services provider for the aviation and travel industry. So we serve airlines, airports, and governments We're owned by the air transport industry, and I guess a core part of what we do is enable that industry-wide collaboration, which is what we're talking about here. I think, as you suggested, I think to start the discussion, it's worth really quickly explaining how and when health passes will be used during international travel, and in particular, how the different stakeholders, including governments, will be able to verify them. And from a passenger perspective, how can we make it a safe and seamless experience, which is obviously going to be absolutely key if we're going to gain their trust to start resume travel again. So I'm going to use an example. I live in London, and if I'm planning a journey from the UK to Singapore via Dubai, clearly, first of all, I'm going to have to identify what requirements or rules are required to enter into each country. So potentially both Singapore and Dubai, I'm going to have to understand. And the challenge is clearly, as we've already discussed, that many countries have different set of rules for entry. And I'm also going to have to understand also what the rules are for my return journey back into the UK. Mm-hmm. So hopefully airlines are going to be able to support me there, and I know they will be. And they'll be able to use systems such as Tematic from IATA, which holds that set of rules on behalf of the industry. There are other solutions as well, but I think airlines are going to play a really key role in that initial step. However, in most cases, I am going to be required to take a COVID test, typically up to 72 hours prior to travel. And I might also be required to have a vaccination. We've just touched on that already. There are a number of governments around the world that do require that if you are going to be quarantine free. Clearly it's a political area, but certainly testing, I feel, is going to be around for quite some while to come. And the rules might be different, actually, depending on whether you have a vaccination or not. It could well be that the government takes a different risk perspective on you as a traveller if you already have a vaccine. You might still need to have a test, but the rules might be different, and that's important to understand as well. So firstly, I'm going to have to go for a test, and when I've completed my test result and my vaccination certificate can be incorporated into my chosen health pass, whether that's IATA Travel Pass or IBM Health Pass or whatever. And the challenge here is clearly we are seeing, as we've discussed already, multiple standards being used by the different health passes. I think there's beginning to be some convergence, which is great. And I think clearly health passes bring a lot of benefit to the end-to-end process, which is what we've been talking about here, in that firstly, they help with identity assurance. So I know the person that's undertaking the test is the same person that's traveling, or we've got a good idea that's the case. And hopefully it's also going to stop forged test certificates. And that's been a big issue for the industry. Across the world, we've seen flights needed to be stopped, can't take off because of the issue around forgeries. So having taken my test, most governments will then require me to complete a health ETA, also known as a travel declaration or a passenger locator form. And this is going to ask me, I'm going to have to go online or use my mobile, and it will ask me a series of questions related to my travel. So, for example, which countries have I visited over the last couple of weeks? And as part of my application, I'm also going to have to verify my health certificate or my health pass. In most cases, really what they're looking for is a green tick confirmation that I've had a test and it's compliant with the government that I'm traveling into, country I'm traveling into. But other governments are going to require me to share more information than that. And we touched on that earlier in the right way, we need to potentially be able to share a copy of the digital test certificate, or maybe what type of test it was, or maybe which test provider undertook that test. And that clearly creates additional challenges for that end-to-end process, particularly related to standards. What sort of test certificate standard are we talking about? And also, and very, very importantly, around privacy, making sure that we are, organizations, authorities are only requesting information that is needed for my journey. So what CETA's been doing in that space, just to give you an idea, is we've been working with the different schemes, the different health schemes, to agree on how best to authenticate a health pass and potentially share other selected information using that online process with governments. I guess one of the challenges there is that, again, as Drummond explained and others, is that, you know, a lot of the health passes are using different technologies. There's different ways to authenticate a health pass. It could be a centralized system, it could be a decentralized blockchain, you know, and there are some of the challenges that we're working through as an industry to make sure this is going to be working. So having submitted my health ETA, the destination government is then going to risk assessment. So they're going to say how much of a risk I am related to my health profile, and have I completed a test, have I got a vaccination. That process, and then what they'll then do is respond back to me with my confirmation that I can travel. So that process is very, very similar to applying for a visa or electronic travel authority like an ESTA. And it gives the passenger a degree of trust and confidence, that knowing that when I'm traveling, I've got some confidence I'm going to be let into the country, which is pretty important. So I think it helps both the government and the passenger from that respect. The next key step is at check-in. And the critical element here for the industry is to enable online and self-service check-in again. Airlines today are having a huge issue and creating a lot of queues at the border and at check-in, because we have to manually check in every passenger and check against the test certificate. So we need to move away from that, and we need to move to online and self-service check-in. And what we believe is the best approach to do that is using something called advanced passenger processing. It's also known as interactive API, and it's used today by many governments around the world to verify a passenger's security and visa status. So it's already in place. And over the last few months, what we've been doing is running trials with the same platform, the same technology, to verify a passenger's health status, as well as their security status and their visa status. So to use my example of my journey from the UK to Singapore via Dubai, at check-in, what the airline is going to do is, and from a passenger point of view, you check in exactly the same way as you did pre-COVID. So check in online, and the airline will send an advanced passenger processing message to both the Dubai and the Singapore governments. And they were both in real time do a verification of my health status against the health ETA or health declaration that I completed earlier, and respond back immediately with an OK to board message back to the airline. And if both governments come back with an OK to board, then the passenger can check in for their flight without needing to show actually their health pass during that online check-in process. So that's also going to help passengers that actually don't have a health pass, that they have a paper test certificate. As long as they've completed the health declaration, then they can still check in online without having to have that digitized version of a health pass. It also helps the government, because clearly the government is really going to be able to understand who is traveling, and it also is important from a government's perspective, because as we've heard, the rules can change very, very rapidly. It could well be that a new virus variant has been identified in the location that you're traveling from, and the government might decide very, very quickly to stop any travelers coming into their country from that particular location. And from a passenger's point of view, what you don't want to do is travel, 8, 9, 10 hours on a journey only to find out on arrival that you can't gain entry. So doing that online check with the government at the point of check-in is very, very critical, and is what we do in many governments, as I said, around the world today, for security and visa checks.
Absolutely. Jeremy, if I may jump
course,
in,
Rebecca.
just because I'm already hearing really good points on interoperability authentication, ensuring standards, thinking about both the traveler, but also the airports and the airlines. And I would love to be able, if it's all right, turn a little bit to the conversation around the health credential and the tools themselves. And then I want to come back to how those tools are, if you will, interoperating with all of the processes you've already started to put forward. So G, perhaps if I could turn it over to you for just a moment. You're the VP of Platform and Marketplace at Change Healthcare. My understanding is that you've been working on both digital vaccination records, but also digital credentials. And I'm hoping that you can help differentiate that for the audience, and would love to hear a little bit more about how you're designing that platform to address some of the interoperability and authentication challenges that Jeremy has raised in his points.
Sure thing, Rebecca. And first of all, thanks all for having me. As a healthcare company, we think a lot about how we can enable these types of workflows to allow the broader ecosystem to get access to the data in the right way, just as you point out, right? Because I'm listening to Jeremy thinking, oh my gosh, if I'm a non-healthcare company trying to get into this realm of health records and health regulations and HIPAA, I mean, before I got into healthcare, I think my head would explode. So let me first give you the 30 seconds on Change Healthcare, just so you understand our perspective and where we're coming from. Change is one of the leading independent, keyword independent, healthcare technology companies in the U.S. That means we work with all providers, all health systems, all health insurers to really power the financial, clinical, and operations of the healthcare system. So as part of all of our journey as patients, because we're all patients at the end of the day, you've interacted with one or more of our products because we engage that whole life cycle. The reason that's important for this conversation is we touch all the places where the data is created. And so if you think about vaccines and tests for a moment, there isn't one place where we go to get vaccines. I might go to my doctor or my provider. I might go to a pharmacy. I might go to a travel clinic. I might go to a mass vaccination site. So all of a sudden, we have this plethora of locations where this critical data is being created. And as Jeremy and Eric and everyone has pointed out, how do you know the data is accurate? And look, I live in the Bay Area. I know that there are parts of the Bay Area that are rabidly anti-vax, and I know that data is going to be somehow counterfeited. So in this place where all the data lives in all these different places, how do we ensure that we get to a place where I know that that data is accurate? So when I show up to the airport, for example, it's, oh, I can trust this thing. I know what it should look like. And so that's where we have to separate this idea of a vaccination record and a vaccination credential. And probably the best framework I can offer to think about that is one of the things we've worked on with the Vaccine Credential Initiative. There is this concept of a certified issuer. That is the place where you can manage the provenance of the data to the point where someone got a needle stick in their arm or a swab up their nose. Right? So I know it happened, I know who it happened to, and it's certified, which means there's some certification entity that does that. At least here in the US, that's an NPI. Right, so I know that you are licensed by HHS, FDA, ONC, or any one of those other 3-letter agencies, right, to do this. There's the concept of the credential itself. How do I communicate that record that comes from that certified issuer to somebody to look at it? And then there's verification. How do I validate that the information that's being provided to me is indeed accurate? And it's important to break this up into those 3 places, because a lot of what we've talked about to this point is the credential. And how do I get the credential in the hands of somebody who can then use it? What we haven't talked about is, how do I know what's in that credential is actually accurate? And that is not a technology question. That is not blockchain. That is not all the other cool stuff. It's, how do I know that I can see the provenance of that data to the point when someone got a stick in their arm or a swab up their nose? And so that's one of the big areas that we operate in. So you think about, how do you do that? So our digital vaccine record product starts by saying we have a set of NPIs. We touch the doctors, we touch the labs, we touch the pharmacies. And so we can manage that provenance. We know exactly what happened where, because we're operating with a licensed entity. We take only what's important, right? So we're not taking 47 fields of data. We're taking the 5, 10 that we need to actually say, this is what I need to know. I need to know who you are, where you got it, what you got, and what its efficacy is, what its time is. And then put that in a place where it's secure and portable. And then you can start talking about the credential. And that's when we say, all right, take that information and convert it into whatever format it needs to be. WHO has a format, sort of. VCI has defined a format. Others have defined a format. It kind of doesn't matter what that credential format is, as long as it's being generated from that certified data. And so this topic of authentication, validation, provenance. It's all critical to ensure that there is some way to take that data and identify that data back to its source. And then I'll make one other point here. The key here too is it's not just the certified source, it's the matching of the patient. Because again, this is coming from multiple places. So we have to solve this identity problem in addition to the provenance problem by making sure that we can get to a certified source of data that's going to come from these networks. It's going to come from people rep and warranting that this data is indeed accurate. And Rebecca, it looks like you want to hop in there, so I'm going to pause real quick.
All to say that I think the patient identity problem in general is a massive challenge in healthcare. And
Amen.
As the healthcare industry begins to grapple with that, and as you know, and as Eric says, right, as these other industries become, quote unquote, healthcare industries or working with healthcare data, they will also learn that. And I think the credential is where the ecosystems around identity and the ecosystems around health data are really starting to come together and really try to answer some of these thorny questions. So observing that and with that in mind and bringing together these two massive ecosystems, Terry, I want to bring you into this conversation because this is what we are talking about, is implementing these systems at a massive global scale. And I know that you've got an incredible amount of experience thinking about, how do you build systems that can support global industries? And so would love to bring you in here. Specifically, tell us a little bit more about where you're seeing sort of points of tension in actually implementing and deploying this work, and where do you see points of consensus and maybe even some surprising consensus?
Well, I think there is surprising consensus. If you read the press, it will say people are divided about digital health passports. They're not. Governments are divided, politicians are divided, editorialists are divided. 99% of American travelers are comfortable with using one, according to Amadeus. 81% of cruisers are comfortable, and many say they'll only cruise on a vaccinated ship. Even the Cato Institute in the US, very conservative, came out with an editorial saying it's a good idea if it's run by business. So we need to do a better job of telling everybody that travelers kind of like this idea. Interoperability is important. The Biden administration has issued an executive order about it. They're talking about it, but we all know interoperability takes time. Look, I ran the SABRE system, 100,000 travel providers, millions of customers. Not everybody was at the same level, but we worked it out. It's going to take time. But, as Jeremy said, look, there's already a system. Every time I fly, my name, my birth date, even my passport information is passed around. So we can send around vaccination and testing data too. But what's I think most important, and what I'm talking to my legislators about, is in the US, the Biden administration kind of washed their hands of a lot of this, but Customs and Border Control should say, here's what we're going to accept. And since they're forcing the airlines and cruise lines to check everybody first, they ought to accept the data that the airline and cruise line already received, right? Because if they don't, the word's going to get out pretty fast this summer. You don't want to come to the US because you can't get in. It's 7 hours in customs, right? So Customs and Border Control acceptance of these documents is really important. And I heard people today talk about paper first. Need to remember 99.5% of tickets are E. The majority of boarding passes are E. That's the way this is going to work. Paper should be accepted, but it's going to be the exception. And it's going to take longer, just like it does when you travel today. So I think at speed, we can do this. It's going to start with airlines and cruise lines. Governments need to accept those documentations. Privacy is super important, as is security. But on the other hand, I wouldn't say we keep your health records safe. We don't have your health records. We should be saying we keep your vaccination and test records safe. That's a lot less scary for people because that's all we have. And really, all we have is a yes, no at the point where you're scanning. So I'm the chairman of a cyber committee at a public company. We work on keeping data safe. We can't keep every piece of it safe. We keep the important stuff safe. I've had cancer. I don't want that disclosed. I'm going to have to disclose that I had a vaccine or a test at the border anyway. So let's not worry so much about, yes, I don't want it stolen, but if it is, it ain't the end of the world, right? I think we have to be practical about these things, and that's how we get them adopted at scale. And remember that travelers want them, Governments need to have a good way to accept them. And they ought to be taking these industry solutions we have and saying, hey, I already forced you to get identified before you got on the airplane or cruise ship. Let me accept that at the border point. Things could happen quickly if we do that. And I know I'm batting cleanup here and we're out of time. So
that's okay. Jordan, I am also realizing that we are right at time, but I did want to offer Jeremy and G to just kind of jump in and provide additional comments on that.
No, it's totally cool. If you guys want to run over, we still have a lot of people on here, and if your schedules allow it, it's totally okay. We can continue.
Yeah, I'll give you one quick comment. And Terry, I couldn't agree with you more. Right? The way that we're talking about this is not taking your full healthcare data set and giving it to an airline, right? And so when we think about making that transition from a certified issuer to a credential provider, I'm not walking up to a CBP agent and showing them my big gigantic yellow card of every vaccination I've received in my life, right? I'm showing them this. That's it. And so when we as an ecosystem think about creating a credential using one of these standards and pulling data and making that data available to create that credential, it really just has to be yes, no, yes, no. That's it. And I think that will go a long way in creating trust, and then following good principles of patient-directed exchange, right? Coming from healthcare, this is our data. It belongs to my vaccination data belongs to me. It doesn't belong to the airline. It doesn't belong to the hospital. It certainly doesn't belong to my doctor. And so making sure that we enable that thought process and saying, guess what, traveler, patient, this is your data. It's with you. If I want to print it out and leave it on the printer at work, it's on me. It's my responsibility to do that. I'm simply going to give you a secure way of doing that, whether it be on paper or electronically.
And this is an 80-year-old process, you know.
Yeah, I mean, it is.
So this Jeremy, is you look like you're going to jump in there.
Yeah, I was going to make that exact point. You know, I think particularly when it comes to the aviation industry and the travel industry more generally, a lot of what we're talking about here already existed pre-COVID. What we're doing is adding an additional information source to it. And if we're going to get the industry up and running quickly, which we need to do, we can't wait for significant new systems to come on board and everything else. No. We're going to have to implement at speed, and the only way of doing that is to integrate with the existing airline processes that are there today. The other bit I was just going to quickly add on is about the passenger experience. Again, going back to the fact that the passenger wants that safe and seamless journey as part of this, and that keeps on coming out a lot in all the passenger surveys that are out there today. They want to be able to use technology for their journey, whether it's biometrics or other ways, so they can have a much more touchless experience as they're walking through the airport or wherever they're going. And that sort of technology is trusted really by a lot of passengers, and they're keen to use it because they can see the benefit that brings for them. And I think we need to be listening to the passengers as part of this process, and really make sure what we're implementing here doesn't just work for the health provider or the government. It's got to work for the passenger.
Absolutely.
I mean, why can't we have a pre-check like experience here? Right?
Exactly.
Put
there was
that
an editorial that said, "Oh no, this might turn out like global entry or pre-check." Boy, I hope so.
Yeah, amen.
that is the
best
point.
Invention ever.
And some people, you see people today who show up with paper boarding passes and they have a difficult time. That's going to still happen. Yeah. But for the people who want to get with the program, let them.
Yeah. So I think it's the conversation here is really great. I am mindful that we're at time. I want to add one more other perspective on this, but also encourage, Jordan, if it's okay for us to keep the room going, happy to, if there are folks that want to stay on and ask a question or two, if that's all right. The conversation around putting the passenger or sort of centering on the passenger and what the passenger wants and that experience, I couldn't agree more. I just want to add a public health perspective here too, though, that passenger is also a person. And when we are thinking about these systems and we're thinking about what we're implementing, what we're talking about is doing something in the middle of a public health emergency. And I think that's a really important context to put forward, right? We've seen the EU has a sunset clause, right? What we are thinking of standing up, what they are saying is, that will end once WHO declares the end of a pandemic. And I think this is where, when we think about the credentialing systems, we're really understanding that they are being built on and alongside and to support other public health interventions. And something I'm always really mindful of is I think everyone on this call and on this panel believes that we should all be able to prove Rebecca, should prove I've gotten a vaccine. I should prove that I have a test, and I should be able to prove that in paper, and that should be accessible and I think, free of charge. And what we're talking about here is what do I do next with that proof? And I think that's an important distinction, that when we think about these conversations and we think about who is optimizing for what solution, there are folks who will optimize for continuity of care. And that's a really important optimization. And so as we think about the introduction of new technology and new systems, we need to think through, yes, we're going to serve travel, and yes, we're going to serve passengers. And we need to think through how they sit side by side for how we're also going to serve people. And that's a hard conversation to have, but I'm grateful to be having it with all of you.
Well, and once you think about travel, right, it's going into places where there's a large number of people. I don't know about you guys. I can't wait to go back to being able to go to concerts and listen to live music. And, that's a little bit scary when we think about, 10,000 people packed into a very small place, or, going and listening to a concert somewhere smaller. And so, yeah, we can talk about getting on a plane, and that's a small group of people, relatively speaking. The same technology, the same thought process is going to have to extend to those places, and the credential, the record, all the things we're talking about here need to be portable in that space. So to your point, Rebecca, the other thing I know we all probably don't want to go back to, or go back to that, one of those two big convention cities, and go back to those gigantic conferences where there's, thousands and thousands of people. It's going to be the same thing. I can imagine going to a conference.
Actually, I disagree. It's strange, but California just said you can have a convention up to 5,000 people with traditional masks and distancing. So my guess in the U.S. is, because I'm spending a lot of time on this with conventions, it's not going to happen. It should, but in very few states will that happen. I think
we're going to bias towards simplicity.
It's mostly for international travel. That's the way it's going to be run, because there's too much resistance to the rest of it. And I think that's sad, but that's true.
It's interesting. We've had a few conversations with CVBs and convention folks, and this to the opposite. Small conventions are fine. When you're putting tens and hundreds of thousands of people, in one place, there might be a reason to do it. But I think you're right. It's going to be variable, right? It's going to be based on the city and the convention and the participants and all that other fun stuff.
And just to bring us home, that variability is precisely why these conversations around interoperability, privacy by design standards, and good guidance on user-controlled and portable data are so important. If we know there's going to be multiple implementations, how do we ensure that those implementations are good and are serving a good purpose? So thank you, Terry and Jeremy and G, for this conversation. Even when we were prepping for this, we all felt like any one of these topics could be a multi-hour long conversation. So Jordan, perhaps even if we weren't the most time-efficient panel, you'll consider inviting us back for a long time.
Thank you, Rebecca.
I think it was excellent. The entire event, the panel, the presentations. Thank you guys so much, and ladies, of course. So we're going to be hosting another event in July, and right now we're figuring out exactly what the focus is. So any attendees or participants, if there's anything that you feel like we're missing or anything that you believe we should do an event on, just please reach out to me. And the recording will be available later this week. And then, as always, if there's any introductions I can make, please reach out to me, and I'll do my best to filter the best introductions and try to use everybody's time wisely. But thank you so much.
Thank you, Jordan.
Thank you, everyone.